This short video is going to focus on diverse prenatal environments and ethical dilemmas associated with conception, pregnancy, and birth. It's important to realize that we do not live in a black and white world. We've talked about this in many classes. Things are very different and diverse, and that's a huge tenet of social work, acknowledging and respecting the diversity that exists within the human population. And so that's no different with prenatal environments. There's different situations and scenarios that individuals and families are facing when someone becomes pregnant. And I think it's important to know a few of the diverse environments and some of the risks that are associated with these specific environments. So the first one is substance abusing pregnant women. And so we mentioned before that the prenatal environment, so when the fetus is in the womb, is very, very important for development, and the mother's choices can largely impact development, health, and future functioning for the child. And so when a woman is abusing substances, so whether that be alcohol, heroin, cocaine, opioids, marijuana, any of those, it could have a negative effect on the fetus. And so the textbook did put this huge list together about what the effects are of certain medications. But it's important for social workers to be aware of this because often some women might not even know they're pregnant and be using. Often, if it's an unplanned pregnancy, women don't always find out for a couple months into pregnancy, and there's a lot of key development that occurs in the first couple months. And so if the woman or the mother's abusing substances during that time, it could already have set the stage for negative development for the fetus and the future child. So it's really important for social workers to provide good education. A lot of substance abuse can be tied to low socioeconomic classes, a lot of cultural implications, and so education around what is actually impacting the fetus is really important for social workers to be able to provide as part of that prenatal care. Marijuana sometimes can be looked at as maybe not so bad because there's legal aspects to it. There's a lot of discussion that, like with CBD, the positives that can be associated with it. But there is a lot of literature showing that marijuana specifically can still have negative effects on fetuses' brain development. And so it's good for social workers to be aware of that and to be able to coach around and help motivate clients who might be continuing to smoke or be using marijuana for either recreational or medical purposes to find an alternative option while pregnant. The second diverse prenatal environment is pregnant women with eating disorders. And so, as mentioned before, having proper nutrition, the vitamins, and the good diet is really important to fetal development. And so if you have a mother who is experiencing eating disorders, so whether bulimia or anorexia, a lot of food restriction, the fetus is also not going to be able to get the proper nutrients as well. And so there's also a psychological piece associated with that, eating disorders. Obviously, you gain weight when you're pregnant. It's kind of inevitable. And so there might be some psychological implications that go along with that. And so if a woman has some dysphoria viewing her body that she's actually larger than she really physically is, pregnancy can feed into some of that dysphoria and kind of illogical perceptions of what the body looks like. And that could be very difficult for a pregnant mother to navigate during pregnancy. The third one is pregnant women with disabilities. And so this is not just mental, it can also be physical disabilities as well. And so a disability can really impact a mother's ability to carry the child. If you're thinking of a physical disability, someone who's bound to a wheelchair might be more prone to blood clots because they're not up and moving and there's more weight pressing on the veins. It might also restrict the types of birth controls that pregnant women or women who do not want to conceive may be able to take. So it takes a good medical provider to be able to navigate some of those things. I think about in my previous practice with women who had a mental disability, had some inability to make decisions for themselves. And so they had a guardian put in place who were making the decisions for them. And some of my clients really desired to be a parent, but it was being determined for them by their guardian that they should not be, and they were being put on birth control and other contraception methods. And so there was this tension of trying to uphold your client's self-determination and their desires, but also acknowledging that the courts deemed them incapable of taking care of them themselves and they had to have a guardian. Well, as a guardian, should they be taking control over reproduction and reproductive rights? So it can be really, really tricky to acknowledge and honor your client's decisions, but also other people who are involved and legally put in place to help them navigate that. Women with disabilities can carry children to full term and be completely healthy, but there's just some nuances in there that we want to be aware of. Incarcerated pregnant women, so women who primarily go into jail or prison pregnant already, they don't have as much access to prenatal care. And there's also the discussion of should they be given special health care or diets and food while they're in prison versus their peers just because they're pregnant. But if they're eating the same food that or meals and diet that their peers are who are not pregnant, is the baby going to receive proper nutrition? And so often women who are incarcerated have experienced a lot of trauma and are more vulnerable and have experienced different things in life, which can impact fetal development. There's a lot of sensitivities to trauma outside of the womb. And so more often than not, women who are pregnant and incarcerated have experienced trauma, and that has some impact on fetal development as well. HIV-infected pregnant women, so women who have HIV can get pregnant. There's no rules or reason why they can't, but there is some risk that their infant will contract HIV as well. And so there's a lot of studying and research going on and figuring out ways to prevent transmission upon birth. And so making sure that mothers are taking their medications, but then also knowing, is the medication safe for the mothers to take while they're pregnant? But then doing some preventative measures once the baby's born, making sure the babies are given safe medication, exploring if breastfeeding is going to transmit as well. If the partner, if you have a couple and the mother does not have HIV, but the father does, and they don't want to risk transmission of HIV during conception, often they'll do IVF or do the in vitro or the insemination and then do it that way, so there's no actual physical contact that could transmit HIV. I think this one is rather fascinating. It doesn't get talked about a lot, but pregnant trans men. So essentially what trans men are referring to are individuals who are born biologically female but identify as a male. And so because they have all the biological parts of a female and are able to carry a child, there's times where, even though they identify as male, they have a desire to still have a biological child of their own. So they might do IVF, taking their eggs and their partner's sperm and then doing the insertion. And so it can get very interesting because there's a lot of stigma around transgender anyways. And then having someone who identifies as a male doing what's often viewed as a female role of carrying a child can be very psychologically hard and very lonely. There's not a lot of discussion on it. It's kind of a stigmatized population. And so the impact of depression and loneliness and maybe possibly poor self-care during the pregnancy can impact the child as well. And so even thinking about the impact of testosterone, a lot of trans men will be taking testosterone prior to becoming pregnant. And so if there's going to be any effects on the child with that, there's research still being done, but also just the impact if someone's taking testosterone and are physically feeling more masculine, taking that testosterone away in order to become pregnant can kind of mess with the head about identity and who they are and feeling good about themselves. And then having the baby, there's still the choice to go back onto testosterone right away, or do you not? And then you breastfeed, which is typically a female viewed activity. And so if they are identifying as male and breastfeeding, what does that look like psychologically to someone? And so it's just, there's a lot of facets of that one to navigate, but I think it's very interesting, and it's something that's a reality in the world today. So again, pregnancy and conception does not just always involve a male and female in a married relationship. That is not the world we live in. And so being aware of the diversity and some of those nuances will help equip you to be a better social worker, someone who's more empathetic and kind of culturally and socially aware. And then finally, I just wanted to mention there's a lot of ethical dilemmas that are, I don't want to say featured, but are present within this life stage. We've talked about some when we were talking about conception and the birth control piece. I mentioned that birth control is not necessarily available to everybody. And so is that considered a human right? Are people, is that something that should be available to everybody? Are people's rights being violated because they happen to be in a lower socioeconomical class, or they live in a underdeveloped country who doesn't have access to all the medical advances and the options and doctors that more developed countries have? And so is this something that we need to advocate for for social justice reasons? And then thinking about infertility and all the alternative options of conception. And so it is expensive, insanely expensive. If anyone has ever had personal experience with someone who has attempted IVF or any of the other fertility methods, it is not cheap, and insurances often don't cover it. And you have to clear a bunch of physical health things first. You kind of have to be in a place of privilege in order to be able to access IVF and different fertility methods. So again, is that another human rights violation because not everybody has access to it? Or is that not something that everyone should have access to because it's taking something that is supposed to be natural and taking intervention that's not medically necessary for people to do? So another thing to consider. We mentioned that abortion is currently legal in the United States, and there's a lot of discussion around there if abortion should be legalized, or is it considered murder, or is that a violation of women's reproductive rights if abortion is made illegal? And so is there ever any condition that an abortion is acceptable if the mother's body or just mother is physically impacted by carrying the child, and continuing to carry it would jeopardize the mother's health and safety? At that point, should an abortion occur? Should abortions be legal in the case of rape, where someone was taken advantage of and was not planning for the pregnancy? These are questions that will come up in your social work practice. And then just thinking about with the advances in technology, there's sperm banks, there's frozen eggs, genetic testing, gestational surrogacy. Some of all of these options are available to some, but not to others. There's also to think about individuals who have frozen eggs and then get pregnant on their first cycle of IVF and then have these embryos that have been fertilized sitting in a freezer, for lack of a better term. Do you continue to keep them frozen because thawing them and discarding them, would that be considered an abortion or ending a life if you believe in life begins at conception? Or do you continue to pay money for frozen eggs just so you don't end what you believe is a life? There's a lot of things to consider. So we have to consider that we all have our personal beliefs around these things. We have our worldviews, we have our own ethics. But there's also a very clear code of ethics that the social work profession has to adhere to: self-determination, human dignity and rights, just to name a few. So those are things to consider when you face dilemmas like this, that you have to take into consideration your client, yourself, the profession's perspective, and kind of navigate these things, because this is one of those difficult things that not everyone agrees with, but you have to figure out how to dance along these issues but still respecting your clients, but also respecting yourself as well. And so these are just a few ethical dilemmas. There's a lot more, but I think it's good to kind of take a pause and think about, like, hey, these are the things that are going on, and what does that mean for myself and for how I practice?